Hi, welcome to our Facebook Live from the St. Clair County Health Department. I'm Dr. Annette Mercatante, and I'm here to answer your questions and to give you an update on what's going on with COVID and other important community events. So let's just get right to the update on COVID. A couple of important changes here, and one I think you'll notice immediately is that we've made some decisions to streamline and simplify the COVID data. Several components were either becoming meaningless as we roll into the third year, numbers are blending together, and or are finding them less and less accurate. So we will be reporting purely on new cases in the past week, new deaths in the past week, and we're going to report on the current risk level as assigned by the CDC. Now, the CDC risk level is assigned not only by the amount of average cases, but also on the hospitalization data, which they draw from CMS Medicare resources that are much more accurate than the ones we were using. So the hospitalization data is built into that current risk level, which remains low at this time. If you have questions about this, we'll be diving into this further. If you do want to look at more detailed data as far as cumulative cases, cumulative deaths, all of that will remain on our dashboard, as well as our immunization rates will remain on our dashboard. So you can go anytime and look at that. Our dashboard is not going to be updated daily anymore, but we're going to do it several times a week. And if things start picking up again, we will adjust that accordingly. So we hope that you'll still find this data helpful. Next, I want to show you what else we're going to be. I just froze. Okay. The other piece of data that we're going to be reporting on regularly, and again, this is based on the CDC risk levels, but it's the color coding of the COVID cases and the hospitalization status throughout the country, and then by county in the mitten here. So that information, you can see that most of the state is at a low risk. We are starting to see a little trending upward in a handful of counties and places throughout the country. And in general, I'd have to say nobody is going down anymore. Most of the cases have stabilized or plateaued or have started to increase a little bit. So what that means remains to be seen. But I think we've seen the minimum amount of COVID that we're going to expect at least for the coming weeks. The good news is that we're not seeing a lot of hospitalizations as a result of that. So, and next slide, I want to remind everybody that we are talking about COVID now in these major three phases: the recovery post-surge phase, which we are currently in. If things continue to grow and become more alarming, we will shift into a pre-surge or readiness phase. This is when we'll be providing updated information more frequently and providing you more information about how you can prepare and avoid undue and unnecessary impacts from another high rate of transmission. And then there's the surge phase or the response phase that is at the top. And this is the cycle that we are going to expect to see. How frequently and how severe remains to be seen, but you can expect for us to shift. You can expect to see us shift from this recovery phase around to readiness and then up to response. Next slide. Another important infographic that's coming from our state partners, and this is a little too busy for you to see, but we're going to post this. What is important to emphasize here is we're not likely to go from a stop or go type of scenario. You know, when this all hit, there was a lot of fear, a lot of panic, a lot of reactions. And now as we go through this, we realize that this virus is here to stay. We're going to be living with this virus. And so decisions like masking, testing, going out and doing things in public are all need to be based on your personal your personal risk levels. So what this graphic does show is that it goes on both the vertical and horizontal axis from lower risk settings to higher risk settings, and then lower risk of you personally to higher risk for you personally on the vertical axis. So what that means is if you are an unvaccinated person with a lot of risk factors disease-wise, and you're going into a high-risk setting, an indoor crowded place, etc., that is a scenario where you may want to use masks and or you may want to test yourself either pre or post those events. I want to add that this really just talks about vaccines, but I also want to share that this is also based on fully vaccinated, not just with primary doses, but including recommended boosters. And if you've been recently infected with COVID, we still consider that kind of a immunity boost as well, but we're sticking with the first 90 days. Beyond 90 days after an infection, the amount of immunity and protection you have from that remains quite variable and uncertain. So you can add that into the equation as well. So it's not a simple yes or no, off or on, should I wear a mask, shouldn't I? This is something every individual is going to have to think through and struggle with as we go through these phases. So next, what do we have next? Do we have another slide? Yeah, again, we just kind of try and keep drilling home the fact that there have been millions upon millions, if not billions, of vaccines given worldwide. These vaccines are safe, they are working, and they are keeping people out of the hospitals. There's been some concern about cardiovascular events with the vaccine. And what you can see here is that although the risk might increase slightly at the risk of a heart complication 2 to 6 times after a vaccination, the amount of risk goes up considerably after infection. So infections are still worse than vaccines. They may or may not provide the same level of immunity that is still being studied. So your vaccination status remains your most reliable mechanism for keeping yourself out of trouble. Okay, now we're going to go on. And by the way, please go ahead and type in your questions. We'll do our best to answer them. I'm going to go back. We always have a couple of little, and by the way, I'm still freezing up. I know. Oh, you're not on yours? Okay. So a couple of things I wanted to make sure we brought up is on March 29th, recently, the CDC did update its booster dose guidance to expand eligibility for people to get a second booster. These are people over the age of 50 and people who are immunocompromised. I've been hearing a lot of discussion about fourth doses and all that, and I want people to understand that it's easier to think of this as a booster dose because some people as a primary series may have received 3 doses. Some people have a primary series as a single dose of J&J. So what this means is you've had a full primary series and then have gone on to get a booster, you can get another booster now 4 months later. And what we believe that will do is boost up your immunity and protect you against the next surge. Everybody needs to consider this, particularly if we start moving into a pre-surge condition, which, watch our website, tune in on Thursday, our Thursday broadcast here, and we'll try and keep you updated. Next is what I already mentioned, alluded to, this coming Friday, our weekly reports will come out, but they will be simplified to include the new cases and death rates in the past week and the current risk level. If you want that more in-depth look at our data, there'll be a link to our website that will take you to all kinds of in-depth data sites, as well as our own data dashboard that includes our local cumulative data. So we will be transitioning our dashboard site as well. And far as updating it a little less frequently, we're not seeing enough changes on a day-to-day basis right now. but I just want to rest assure everybody that if we see levels increasing, we will respond and adjust our updates accordingly. Okay. Jen, do we have anything?
Hi, I just wanted to let everybody know that if you have any COVID questions, we're going to save those to the end because we are changing the format of the show today. So you did your data review, the talking points, and then we're going to have our special guest on, and then we'll
And,
hit the COVID questions.
right. And so now on to our special guest. I'm delighted to have him on our show. Alphonso Amos is the executive director of Black Lives Matter, and I've been honored to work with him on several projects over the last several months. So, welcome, Alphonso.
Thank you so much for having me, Dr. Mercatante.
So, we have you here to primarily discuss the Southside Spring Festival that's coming up. But of course, if you have any other important issues to discuss, I just want to say this. I think that the relationships and the communication that we need to address health equity issues and to make sure that all of our citizens have access to the best health care or the best health that they can attain, it's important that we form and develop trusting relationships. And working together, I think, is one of the best ways to do that. And it's been a pleasure working with you and some of our other community members. So thanks so much for being so open to that. Let's start by telling us, tell us what people can expect from the Spring Festival.
Absolutely. And again, thank you so much for having me. And it's been a pleasure working with you as we focus on health equity, especially from my perspective for Black folks. And so I definitely appreciate all of your endeavors on making sure we have equitable practices within our county's health system. And so this Southside Spring Fest, I'm so excited about because it is something we've been planning for a few months now that was driven based off of community collaboration and helping really understand providing resources and access to health screenings and things like that for the folks on the South Side. And so the Southside Spring Fest is going to be held on Saturday, April 23rd, right at the Community Mental Health at 3111 Electric Avenue, right in the city of Port Huron from 10 o'clock to 3 p.m. This event is free and it's open to all people. We'll have hot lunch for all attendees. There'll be a grocery giveaway. There'll be health screenings, prize drawings every half an hour, and things like that.
Yeah, and I think it's great. I think one of the important aspects of this is that we provide these resources where people are and where they live, and meeting people where they are, I think, is a really important step as well. So yeah, I'm excited about it too. I think it's going to be a great event. So who's putting on this event? Who's been involved?
We have a number of organizations, several community partners have come together to put this event on, including SCORE, St. Clair County Organizing for Regional Equity, the Port Huron branch of the NAACP, Black Lives Matter Port Huron, the Diversity Initiative of St. Clair County, the YMCA, Blue Water Area Chamber, the St. Clair County Health Department, St. Clair County Community Health, Community First Health Center, the Community Foundation of St. Clair County, and the Food Bank of Eastern Michigan. So it's a plethora of folks coming together to collaborate to make sure this event is a successful one.
Yeah, it kind of goes to the fact that together we're better. When we merge our resources, I really think we can really expand on what we're able to offer people. So you mentioned health screenings. What specific health screenings are going to be available here?
Some of the health screenings that will be available are physicals. There'll be immunizations, including the COVID-19 vaccine, available for folks, lead testing, depression screenings, blood pressure, body mass index, diabetes screening, sleep apnea screening, oral health screening, and much more.
Yeah, I might mention we're also going to have an Ask the Doc table. I'll be there, and later on, we'll have another community physician there, not to diagnose or treat, but if you have questions, it's a great way to just kind of air your concerns and have a informal chat with us. So please feel free to join us and visit all of those stations because I think they're all important. So, in addition to the screenings, there's lots of prizes and resources that are going to be there. You want to describe some of the prizes that are going to be available.
Absolutely. I mean, some amazing prizes. I wish I can get in on winning some of these: the bikes, the grills, the Fitbit watches. We have gift cards, gift baskets, and so many other things. And so the more screenings you participate in, the more resource tables you visit as you're a part of this event, the more raffle tickets you can get to earn more prizes. And so you can earn a lot of different prizes by just attending and participating, by visiting the resource tables and getting the screenings that you need.
Yeah, this is going to be a big event. We have a lot of things happening. And of course, this requires a lot of manpower. I do understand we could still use some volunteers. How can people volunteer for this event?
Absolutely. We are in need of at least 60 volunteers, including folks to set up and tear down, unload the food truck. We need general runners and so many other components of this event are in need of volunteers. And so folks can register as a volunteer using the link that is included in the Facebook comments.
Yeah, and I just want to include that if you don't want to devote this event runs from 10 till 3. Is that right? 10 till 3
That is
p.m., 10
correct.
a.m. But if you don't want to stay till 3 p.m. or you don't want to get there at 10, we'll accept any support and help you can give us for as long as you're willing to give us. So please don't let the duration of this event scare you away. Anything you want to give will be accepted. So Alphonso, we've talked about the importance of health equity, particularly among minority populations. We know that the health outcomes in minority populations are significantly worse than other populations. Um, why is an event like this important? Why do you think an event like this is important to particularly the Southside community and people of color?
Well, I think an event like this is important for a number of reasons. One, it's an opportunity to reconnect with friends and neighbors while COVID risk is low. We know a lot of folks have been shut in. We haven't been out, which has also caused a number of mental health issues for a variety of people within our community. And so this is an opportunity to get folks out, get folks to really gather and get that sense of community. But then it really connects individuals to the important community resources that are out there. A lot of times people don't know what resources are available to them. And so by meeting people where they're at and sharing those resources, we are now educating folks on what's available for them. And then it's one small step in addressing health equity in our community. As we meet people where they're at to get them the proper screenings they need, as we make sure people are provided the proper resources and education on different topics and surrounding health, whether it be mental, physical, or emotional health. It provides folks, again, with the sense of a belonging in their community, in a sense that the health officials in the realm of whether it's the St. Clair County Health Department or community mental health or a number of other entities care and really help really meet people again where they're at, but also it builds a sense of trust throughout the community by just being present.
Yeah, and I would say I think that idea of relationship building, we have all kind of lost touch with those human bonds, right? In the last couple of years, they've been rough. So relationship building and building trust, and expanding that, I think, is a really important step in whatever we have to do now. It's the first step, I have to say. If we don't do that, if we don't meet each other and greet each other and laugh together, I don't really know how we'll be able to move forward. So I think I'm really looking forward to this as well. What part of this are you excited about?
See, I'm excited about it all, but most importantly, the entertainment. We have some entertainment coming. You have James the Saxman Thomason. We have our folks at uh, Citadel Theater coming to do some things, and just excited about that. Excited about seeing everybody together. We got Sons Outreach, who's going to be on that grill, getting the hot food prepared, and so many other components. Whether it's the YMCA's Y on the Fly program that'll be out there helping connect kids to outdoor activities and things like that. So overall, the whole event is exciting to me.
Yeah, it's been focused on providing a fun atmosphere. This started out, Dr. Mercatante, all I could think of is health screening and, you know, They're not, by the way, they're not going to let me do a speech. So you won't be hearing any boring statistics or any data or anything like that. But the idea morphed into, let's make this a really fun event so that people aren't nervous about coming out. No one's going to, you can just come out and have fun. No one's going to force you to go through a screening or to do anything you don't want to do. It'll be there. It'll be free. It'll be easy to access. The only carrot there is if you do more screenings, you have a greater chance of winning those great prizes. So that was our hope. But really, it's about the fun and having fun together.
Absolutely.
So, I mean, what do you think we should be looking at next as we do this big event and start looking at relationships and what people need and how they respond? Because we are going to be looking at who's getting what screenings. I mean, this is going to be also a good opportunity for see what people need. You know, are we finding a lot of diabetes? Are we finding a lot of hypertension? So that's an important component of this as well. Would you see redoing things like this, or how do you see this playing out in a community like ours?
Yeah, I definitely think it's going to be a multi-pronged approach. I think this is the first step. I think as we collect some of the data that we need to collect from folks as they come to this, we see how many screenings we do, we see what resources folks really need. It will give us a sense of where we need to go in a direction. And then it also allows for the buy-in of the residents, right? We've hosted a series, I know, between you and SCORE, hosting a series of town halls surrounding health equity. This now will allow people to know that this is a topic, this is something that we care about deeply within our community, especially as it comes towards reaching minorities and what that looks like in terms of health equity. And so I think we'll definitely have to do more events like this. I think that the collaboration amongst all of those amazing organizations that I shared has been remarkable. And just bringing
Yeah.
everybody together in that regard is going to be key because we now have a shared resource to make sure we can streamline folks to whatever opportunities or needs that they have. We can direct them to the proper resources that way.
Yeah, I just wanted to, part of this started with COVID and some COVID opportunities with COVID dollars to try and improve COVID understanding and vaccinations. Again, in no way will you be forced to get a COVID vaccine or whatever, but I think it's important to note that with all of our working together, and it's not necessary for all of us to agree on all of these things. What's important is that we have some common goals, which is to make people healthier and to improve our relationships together. So I want to make that clear that even after the COVID clinics, not everybody in the community was part of that, but working together, it was remarkably successful. So there's a need to move, I think, forward, understanding each other and understanding and listening and really listening to what people want and need and how they feel about things, and not necessarily that we're all trying to do or feel or think the same way. And I think that's important. I think that's one of the things I've learned is that we don't all think alike, and it's okay, right?
Totally agree with that. I think we have a plethora of different viewpoints at the table, but I think what is important to me and what resonates in my heart is the fact that everybody, whether it is different viewpoints, all have one common goal in mind, is to make sure that we have equitable health practices, equitable access to health resources within our community. And so that's, to me, inspiring in itself.
Let's face it, everyone wants to feel good. Nobody likes being sick, and nobody likes the suffering involved with illness. So I think we all could agree on that. Moving forward on that is going to be a positive thing. Anything else you want to share with us, Alfonso?
No, I think we hit everything. Again, for y'all who may just be tuning in, definitely check out the Southside Spring Fest that's going to be held on April 23rd, right at the Community Mental Health at 3111 Electric Avenue, right in the city of Port Huron. It's from 10 a.m. to 3 p.m. And remember, we need volunteers. So whether you want to come for 30 minutes, an hour to help set up, anything, stay the duration, we need your help. And then you can follow us on Facebook at SCCMH Southside Spring Fest for more information.
Great. And it's I wanted to make sure it's in the back of the building. So if you walk if you're coming in from Electric Avenue and it looks like nothing's going on, it's all in the back of the building. So walk on the back and you'll see it all. Tents and activities. And like you said, we should be having a lot of fun. Thanks a lot for joining us, Alfonso. I really appreciate it. Jen, is there any comments or questions that have come in?
Hi, there's no questions about the event that I see, but there are some COVID questions, so we can wrap up the show with answering
Okay.
those. So thanks for everyone who is patient with that. And thanks, Alfonso, so much for being on. Okay, Linda asks, I'm 63. When should I get the second booster? Should I wait until the case numbers go up?
No, not necessarily, Linda. If it has been 4 months since your first booster, you're eligible. Remember, a booster takes a couple of weeks to go up to really kind of boost your immune system up. And we have no idea of predicting when we're going to see increased cases. Again, how quickly you get that booster depends on your circumstances. Are you around grandchildren a lot? Are you traveling? Are you starting to venture out now with friends and family and doing social events? If those answers are yeah, you might want to get your booster sooner than later.
All right, the next question is from Denise, and she asks, what is my risk of getting COVID after having 2 booster shots?
I don't know the absolute risk. We know that the booster shots, and I would just say the vaccines in general, are very good. They are amazingly good at keeping you out of the hospital and preventing death from COVID. It's not, and it's probably going to reduce you getting infected or getting a serious infection, but I don't actually know those numbers. I don't think that's very clear to us yet. So I don't want you to get the booster thinking that you're not going to get infected. If you are exposed or having symptoms, whether or not you're vaccinated or not, you should still get tested so that you don't inadvertently spread it to other people as well. The value of this vaccine, though, is to prevent serious outcomes from the infection.
So another booster question, which you kind of already spoke of, but this person asked, Dan asked, why do you need a booster?
Because the immunity is not lasting for long periods of time. We are seeing a reduction in immunity, both from the vaccine as well as from getting an infection. This is a characteristic of our immune system and the type of virus it is. In fact, I think there was an anticipation that we would see waning immunity because it's a coronavirus, and this is a characteristic of this type of virus. Not getting into the details of why this might be, there also might be some cellular response, but we're clearly seeing after a period of beyond 90 days of more people being susceptible to infection. So the booster is really intended to boost your immune system back up where you can be better protected.
All right, the next question is from Elizabeth, and Doc, you might want to follow along because this is kind of a long post, but she said, I was boosted in October and in December was extremely sick. My PCR was negative, yet I had all the symptoms. A couple weeks ago, my pulmonary doc sent me for blood work for antibodies and it came back positive. He feels my PCR test was a false negative and the person did not do the test properly. How long after a positive antibody test should I wait for my second booster, or should I wait to see if a new booster comes out that addresses the most current COVID variants?
Okay, so you don't have to wait based on antibody tests. If you're eligible for a booster, if it has been more than 4 months since your last booster shot, you can get your second booster as soon as you're well. If you got sick and let's see. Oh, so your booster was in October? Okay, so your booster was in October, and then December you got sick, and all things are pointing towards that was a COVID infection, even though there was maybe not some clarity with your labs. Okay, so now it is April, I believe. So there is no problem with you getting a second booster at this time. Again, you don't have to wait for vaccines against COVID based on infections. All we ask you to be out of isolation so you don't infect other people and that you're not still actively sick. As you know, the booster can make you achy and tired. And if you're already still feeling pretty crummy from your infection, you don't want to add that on. So we want you to feel better and be beyond your isolation period and that the timing is right. Now, going back to that last question, should I wait and see if a new booster comes out that addresses the most current COVID variants? The current booster is responding well to the current variant. The current variant is a variant of the Omicron. It's a direct sibling of that, I guess, and it is still very responsive to the current vaccine. So although there is close scrutiny of new variants and the potential of creating a new vaccine to respond to new variants, this current vaccine is still pretty effective, especially with the booster dose. So I wouldn't wait because right now the problem is this variant. It's what's going on right now. We don't know what's going to be happening in the next 4 to 6 months. No one has been able to predict that particularly well.
All right, the next question is from Pat. I'm 70 and got the Moderna booster in October. I was exhausted and had a low-grade fever for a day and then was fine. I got the second booster this past Monday, was again exhausted with low-grade fever for a day. But this time I have tenderness in the armpit of the arm I received the shot that has not gone away. Are my lymph nodes just on high alert?
I'm not sure what the lymph node means, but what you're experiencing after the vaccines are common vaccine side effects. Okay, they're very common: sore arms, fatigue. They're short-lived. They're usually 24 to 48 hours. They're not associated with any serious outcomes, and it doesn't indicate that you're having a significant problem with the vaccine. Now, if you don't have those side effects, it doesn't mean that the vaccine's not working. I can't really tell you why some people have these side effects and others don't, but they are common. They shouldn't be too concerning. And if they're not terribly uncomfortable to you, I don't think you have anything to worry about as a result of experiencing that. The vaccine should be fully effective for you. I'm not sure what you mean by the lymph nodes.
I think because her armpit was sore underneath,
Little
so lymph
swollen.
nodes in the
Again,
armpit.
that is a reported issue with the vaccine in some people, but it's not associated with any problem with the vaccine.
Okay. The next question is from Stephen. What is causing fatalities still in the county? I'm not sure what he means by that, but
Yeah, I'm not sure what you mean. So, we still have our number one cause of fatality is still cardiovascular disease. Our number two cause of fatality, I believe, remains it's either stroke or cancer. They've been the same, number one, number two. Now, what's alarming, and I don't know if we're going to fall into this room, but in many places in the country, COVID-related deaths are turning into our number three greatest cause of death. Now, here in St. Clair County, our numbers are lower. I don't know if we're going to fall into that, but I could certainly tell you that COVID-related deaths are going to end up being a significant cause of death. Not number one or number two, questionable number three, but right up there with third, fourth leading causes of death, which are typically respiratory infections, by the way, in elderly people. And remember, causes of death do vary by age group. So that's also going to be a caveat and an adjustment. So we'll be looking at that information very closely. Death data is a lagging indicator. It takes us a while to sort through that data, to review the death certificates and cause of death carefully. So don't be surprised if we're a good year or two down the line before we're able to speak to that intelligently.
the next question is from Darlene. She said, I'm a follicular lymphoma cancer survivor where they killed my immune system with chemotherapy a few years ago. I've had both Pfizer vaccines plus a booster, and then a month later I got COVID. Due to my low immune system, I then received the monoclonal antibody infusion on January 4th. My question is, when should I get the second booster? Remembering I have had both COVID and monoclonal antibody infusion. Thank you so much.
Right. So again, having a COVID infection doesn't mean you have to delay your vaccine. Although I can tell you that you probably had a boost of immunity from that COVID infection that's going to give you some extra protection, again, for a minimum of 90 days in some people. Now, you've described your health history, which is going to suggest that you may continue to be immunocompromised. So it's really impossible to say whether that recent infection, boosted your immunity to a level that's protective. So I believe you should still get a booster 4 months from whenever that last booster was. By the way, the monoclonal antibody infusions are no longer, we were saying at the beginning that if you received a monoclonal infusion that you needed to wait 90 days for a COVID vaccine. That restriction has been removed. There's been enough data and enough scrutiny of the information to know that a vaccine is still effective following a monoclonal infusion. So there's no restrictions time-wise for that, other than, again, what I just said. You got a monoclonal infusion because you got COVID, and we don't want you to get a vaccine while you're still sick from COVID or while you're still in an infectious period, which is 10 to 14 days. If you want to play it real safe with somebody that has an immunocompromised condition, you might want to extend that 14 to 20 days, potentially infectious. And worst case scenarios, people who have poor immune systems might take a little longer to recover from a COVID infection and stop shedding virus. So I guess I hope I'm not confused. The bottom line is you can get your booster at this time as long as, does she say when her last booster was? Doesn't. You want 4 months in between that booster, for your last booster and this booster.
All right. So I don't see any other questions. So I just wanted to remind everybody we'll be back on once a month. On the next one is in May 12th, I believe, at 3:30. And what we're going to do is we're in the recovery phase. Is we are going to bring up different relevant topics. We'll always have a COVID update. We'll bring up relevant topics, maybe have guest speakers as well, and then answer any questions. So we thank everybody.
I just want to remind everybody that we will be issuing updated data on Fridays, as we always have. We'll be pushing that out on social media and also posting on our website, so you can keep track of what's happening there as well. And if we need to bump up these COVID updates, we will do so. So be safe. Enjoy this time where we can actually go out and meet and greet each other, but be safe. If you feel like you're sick, especially if after an exposure or travel, we're recommending testing. If you've traveled, test 3 to 5 days later. All of you peeps that have been spring breaking, we'd like you to test 3 to 5 days after you return, so that you don't inadvertently walk around spreading this virus to other people. And have a great summer.